I would like to thank the committee on health, education, labor, and pension. And also thank you to the Honorable Senator from Massachusetts, Elizabeth Warren. I submit this testimony as my support for the Keep All Students Safe Act. The act will establish much needed standards, prohibit personnel from managing students using restraint or adverse behavioral interventions. Will require state and local education agencies to ensure that personnel receive state-approved crisis intervention training. Requires schools to establish procedures to notify parents if physical restraint or seclusion are imposed on their child. My name is Coleman Nee, and I speak to you not only as a concerned citizen, but also as the uncle of an autistic school-age child. This act is imperative because the Education Commission reports that students with disabilities are restrained or secluded at a much frequent rate. My concerns for my nephew have been heightened to learn that there are no federal guidelines for the use of seclusion and restraints. Many students with disabilities lack the ability to communicate what happens to them effectively. Many disabled children may be nonverbal, unable to communicate in conventional ways. Also, I reference in my report the work of Peter and Pam Wright, who advocate for individuals with disabilities. They report that children with disabilities are sometimes exposed to the possibility of abuse due to bad behavioral levels and ways of communicating. In my position as a mental health worker at Newton Wolsey Hospital, I have seen firsthand how easy it is to mistake bad communication for bad behavior. These mistakes in judgment can turn an otherwise benign situation into a traumatic event, not only for the client, but also for the staff. State policies are varied, and in some cases non-binding, such as in Virginia. While all students are vulnerable to these practices, students with disabilities are at a much greater risk. In a policy snapshot from the Education Commission of the states, it was reported in 2013-2014 that students with disabilities made up 12% of the public school population, yet comprise 67% of those who experience restraint in schools. Children that have been subjected to these practices have suffered physical harm, psychological injury, and some have even died. For the reasons stated in my testimony, and for many more, I again state my support for the Keep All Students Safe Act, and ask that you do the same. Thank you again to the committee and to the Honorable Senator Elizabeth Warren.